the similarities between the kidney and the dialysis machine. So we did this kind of stuff where to talk about the yes. Okay, great. So let us proceed. So we are talking about the similarities between the kidney and the dialysis machine. So I said that both remove urea and other waste products, and they all both help to control the amount of water in the body. So today I've just added new points, in addition to what we did yesterday. So yeah, they both maintain the balance of salts like sodium and the potassium, the balance, and they both keep the body composition stable throughout the filtration. Okay, so I said that they both ensure that useful substances like proteins and blood cells remain in the blood. Yeah, that's the similarity. So uh, we also did about the differences between the kidney and the dialysis machine, where I was saying that the kidney is natural, while the dialysis machine is man-made. Yeah, it's just part of differences. And in terms of control, we can say that the kidney is controlled by hormones, while dialysis machine it works mechanically without the influence of hormones. So yeah, it's technology, it's science that helps this machine to work. But the kidney actually is controlled by the hormones, like the ADH hormone and the aldosterone hormone. And also the process, we say that the kidney performs continuous filtration, while the dialysis machine works only during the treatment sessions. Okay, yeah. So whenever you have got a patient, uh, that day or that particular time, it's when you can see this machine performing its functions. Once the patient is done, and then this patient can be sent home, and then the machine can be switched off. But the kidney, you can't switch off kidney. The kidney does this process of filtration, yeah, continuously. Yeah, so on the part of selective reabsorption, I said that the kidney can selectively reabsorb useful substances, while the dialysis machine cannot reabsorb substances. Yeah, so these are just the part of the differences. Yeah, so all blood is passed through the machine, while the kidneys, well, in the kidneys, only in the glomerular filtrate, the blood can enter into the nephrons. Right? Yeah. So these are just some of the points that we discussed yesterday. So today I wanted us to finish this topic by looking at the common kidney problems. So actually these problems, the ones that affect the kidney functions. So there are a lot of these problems that are affecting people each and every day, yet in the world. So people are facing difficulties in terms of the kidneys. Like in Malawi, we have different people, but the famous ones are the Lucius Banda, the late Lucius Banda, and of course his brother. Yeah, they're also having the same issues. So it's a serious issue. It's a serious problem that we have to understand. Okay, so actually we have the commonest problem known as the kidney failure. Yes, so I think we are having some people from the medical industry. You guys, can you help us to understand what is this problem actually, the kidney failure? Because we don't know enafestimaziwa so tatuzani. Yes, aida togo aina chisomo in Nathan. Can you please come up and then teach us something on the kidney failure? Yes. Just the basic knowledge, eh? Not a good deeper one, just the basic knowledge. Yes, Mr. Jisom. Uh, what is this problem? Yes. Yeah. Yeah. Mm. Yes. Yeah. Yes. Yes.
Take a picture bladder it. Imana matuka chotupa amene moyo.
Yeah.
Ozozikanika kuti utuluke bwinobwino. Kudine ikhala zoti yapangidwa ya mungosunga mkozo. So that they are the most causes manufacture. That's a failure. Ulakamati heart failure. Ndoti mtima imakhangati end organ failure yoyo. Kuti panali vuto lina lake, condition ina yake imene mwina sinapangidwe treatment. Kapena sinapangidwe intervene mu nthawi yoyenerera, then imabweresa no failure. I think we understand failure ngati tikamati talakwa, it's all about kuti we tried mwine koma we have failed. That's the same thing. Kuti organ ya kidney ikanika kupanga function bwinobwino, palibenso china chilichonse choti choopsa muno kandi yoti ikanika kupanga function bwinobwino. So makoze sena, of course, makoze sena oti tikuwadziwa ndi malaria, malungo ache amatha kubweranso kidney failure in typical komanso ngati ma sepsis amaitchula sepsis infection ngati moja imodzi mwa ngati pali aina pyelonephritis isn't you get my concept ndilekeze
Yeah, so akutero adokotala kuti mavuto amene a kidney failure ndi kuti akamba nkhani zokuza kuti the kidney is in a position whereby it cannot work properly. So actually we know kuti the kidney has to filter the blood, has to remove the waste products in the blood. So otherwise it can have several problems. So there can be a problem whereby this kidney is failing to function properly. Okay, it is failing to do its job. So yeah, paka mavuto mbirimbiri. Yeah, so actually if we put some points, as he said, I think he was talking about this point, yeah, untreated infections. Yeah, so it can also cause kidney failure, as he said, eh? Yeah, so as many as high blood pressure, diabetes, of course blockage in urinary tract can also cause the kidney failure. And also, yeah, use of some drugs can also cause the kidney failure. Yeah, so there are also what you call the treatment of the kidney failure. Of course, it's not easy. It's tough. Is it easy to treat this kind of problem? Like you guys who work in medicine, in the medical industry, is it easy to treat this problem, or it's not easy?
If it's in acute ngati before maybe 3 weeks is treatable komanso imakhala ndi cause yake kuti cause yake is it treatable komano ili ma stage pali stage 1 stage 2 yeah I think stage 1 stage 2 mutawipanga treat stage 3 ndi 4 imakhala basi ndi kuti you can treat.
Okay, yeah, so that's it.
Yeah,
so
because my infection like ukapanga tako my infection yo yeah issues of to do with my low BPs ukapanga maintain diabetes kuipanga maintain bwino yes ngati blockage yonso ili yoti can be repaired yeah izabwino bwino.
Okay, that's great. So the treatment plans, actually you can try to remove waste by using the dialysis machine. Okay, yeah, of course, kidney transplant. Transplant, do you do this one in Malawi? Kidney transplant?
No.
Oh, okay, so I think tisadwale otherwise tifanazo. Okay, kidney transplant ndekuti mwina afika pona kuti singapangije treated. So mumakasintha ma kidneys yo kuyikapo ena. Okay, so vutais. So as he said, you can also try to control the blood sugar and the blood levels, the blood pressure. You can try to control them. Okay, let us look at the prevention. So actually we can prevent this problem. Is it true? Should we drink enough water? Okay. So they're talking of drinking plenty of clean water. Okay, they're talking of eating balanced, raw salt diet. Okay. Avoid alcohol and harm of drugs. Shall we know? Treat infections earlier. Okay. Shall we know? So I think it's clear. So in the minute problem ina mnaifuna kwazaso mnanena kuti imakhala na imene the glomer talenga imaliwa it's the glomer saka ndizofuta za inosa kuchipatala isimaliwa atho kutalenga napo
glomerulonephritis.
kalache talenga kalache uli kuti
Nilikwanga nusu ndina kuchipatala.
aya zofuta izi abachisomona baliphunzise basi inu talenganisi mwati chani mwandira
Yakuyenga ndichisomo.
talenga na
glomerulonephritis.
oh gulo mwali gulo ya tizilumala gulo okay glomerulo nephritis okay tabu glomerulo nephritis okay tabu. So mwati chifuna mene makantu antu ndiwanji how is it like
It's just an inflammation of the glomerulus filtrate.
yes
Imachitika because of my infection my infection throat.
yes
Kuti mwina akhalisa nthupi moja this amakhangatalwa mu system mu blood system ndakamakasephedwa pa glomerulus paja amatha kusiya ma antigens pamene paja so ma antigens amapanga react ndi wachani ya glomerulus ija ndamatha kupanga inflammation komanso mwina ngati ili bacteria imatha kumadya abe pamene pajapo. Yeah, so it causes phlebitis. That's like this is inflammation. Paliponse pamene ungaone this is inflammation kutupa. Yes, so that's the glomerular nephritis. So the this is just a matter of kuti chinthu chatupa basi. Yeah, so matochitika so anthu ena kuti adwaya scabies ija ikalowa mkati kwenikweni makapangaso atati so pa glomerulus paja pere. Yes. So mangofunika antibiotic basi.
Antibiotics. Okay, that's great. So let us see. So talking about these are the notes which I got. So the thing is, it's inflammation of a glomeruli in the kidney. Okay, simple as that. I think you and I enough it's inflammation of the glomeruli. Yeah, so it is caused by actually some bacterial infections, sore throat. Sore throat or autoimmune diseases. Autoimmune diseases. Okay. Fine. So just causes and then treatment, as he said, he talked about the antibiotics because it's it's bacterial infection. Then you can just take the antibiotics, and then they're going to do the bacteria, and then actually you'll be fine. At least take some rest and try to control your blood pressure. Yeah, you can avoid this problem. Okay. Great. So the other problem is what you call Mwandiyani? Talenga ni Mwandiyana wa? It's what?
Ngokanga pyelonephritis.
Pyelonephritis. Okay. So it's also the infection of kidney and renal pelvis. Okay. Fine. So you come to know how is the problem? Yeah. How is it like?
I think this one imapanga attack ngati manephrons yacho. Typical of manephrons kwambiri. koma ndi infection yomweyo, so ndi ngati inflammation of my nephrons. Yes.
Okay, so mangani matupaso. Okay, that's great. So
Sorry?
Okay, I asked it, it's like my nephrons ama kaso ndo tupa like that.
Yes.
Okay, so it's also caused by the bacteria from the bladder moving up to the kidneys. Okay, so if you have got those kind of bacteria and then they are moved, as he said, from the blood up to the kidneys, yeah, they're going to attack the nephrons, causing them to inflammate. Yeah, because it's bacterial infection, it means you can just take the antibiotics. Yeah, so I don't know antibiotics ake ndadima kusashito. I don't know kuti amwewa achina. Yeah, so maybe it's a special antibiotic that you use. So you can also drink a lot of water.
Akina Cipro.
Oh, ciprofloxamine. Okay. Antibiotics like those. Fine. Drinking plenty of water and good hygiene can also help to treat. So it's not part of business, to go deep. Just understand there is that kind of a problem, and that can be caused by the bacteria. Yeah, and be able to mention it is pyelonephritis that causes the inflammation of the nephrons, and it is caused by the bacteria and can be controlled or treated by the antibiotics. Also, mpaka e.g. ciproflo. That would be, yeah. Of course, they will know what the the stuff. Okay, so this is the other problem. Talking of it's what? Protein what? Proteinuria. Okay, proteinuria. So it means it's what?
It's the mountain, but proteinuria.
Proteinuria.
Okay. So what is it actually?
I don't remember. You said beginning by glomerulus, but just some proteins,
Yes.
So this is the presence of proteinuria, is the presence of proteins in the urine. That means you live safe paja. Kama tukupia majani, ma proteins, matuka maga kuseka majani, muma mimigozo.
Yes.
So imakangadi uli glomerulus ija onongeke. Yes. So if you safe maana if safe and this goes. So amagabanga urinalysis or urine dipstick. Proteins. Yes, or urine dipstick. Namagapesa mo kuri muoneka ma proteins. Ma proteins ake because nthazi namapeseka mama ene asaduse +2. Koma akayambira +3 and +4 ndio damakhaza kuti ndambiri. So it causes this problem. Why makhaza kuti achitika pa safe paja? Kuti ndio siku safe bwino. Yeah, we do some molecules akulu ngati na proteins.
Okay. So ikapanga glomerulus ikapanga loss its permeability it allows these kinds of proteins to pass through into the glomerular filtrate. Okay.
Yes, normally utawapezamo red blood cells are just wakutuluka.
Yes, of which is not important. Okay, that's great.
Yes,
yeah, okay. So actually the proteinuria, it means presence of proteins in urine. Okay. Yeah, so actually it is caused by the kidney damage. Okay, high blood pressure. Of course, there's some bad diabetes can also cause the same thing. And of course, if that part, like the glomerulus, has lost his permeability, it can also result into this kind of problem. So treatment, actually you manage the main cause and reducing salt and protein intake. Yeah, so basic knowledge, the main yeah, you can just put all those kind of things. So we have got what you call the uremia. Uremia, okay, build up of urea in the blood, okay, due to kidney failure. Since the kidney is failing to filter the blood, it's failing to remove urea from the blood because it has got the problems, then these kinds of urea can build up, can increase in number in the blood. So that can also be a problem. So actually it is caused by the kidney disease or blockage. Okay. Actually treatment yake just go for dialysis machine or replant the kidneys. Remove those kidneys and then put other kidneys. We're going to reduce this kind of problem. Okay. Once we have what you call the kidney stones. As he said, he talked about the presence of stones in the kidneys due to accumulation of the uric acids. So actually my signs and symptoms here, there is back or side pain, blood in urine, and pain when urinating. Kumabe pain when urinating is caused by different factors. It's just part of the signs and symptoms of the kidney stones. Yeah, sikuti inu mawa mukatenga zotengatenga ndiye mukufa kupweteka ku pokodza muzili ndi kidney stones. Itha kukhala kidney stones atokasomatize. Yeah, so paja in medicine amanena kuti several or multiple factors can contribute to a single health problem. So or multiple signs and symptoms can be caused by maybe a single or different health outcome. So malungo munthu akuzipangitsa kuti mathupi liziphwanya, chifuwa sichitipanso mwa mthupi liziphwanyazo. So it just depends. So sunganena kuti basi ndikuti pain when urinating ndikuti basi ni kidney stones. Patokanso ngati metastasis ena. Yeah, so just to be balanced enough, right, to check with the medical doctor. It's going to tell you what exactly thing is causing the problem. So actually have back pain, yeah, kufa kupweteka kusana, blood in urine. Yes, when you're urinating you produce blood and then you have pain. So palima size ambiri akuluakulu izongo just basic knowledge. Yeah, so the kidney stones. So actually it is caused by lack of water, too much salts, calcium in the diet, or actually so the presence of uric acids can also result in the problem. Nde bayidagamba kuti madzi pa tsiku munthu mwamwa kwati 2 to 8 liters of water. Yeah, we can help to reduce these kind of problems. Yeah, so you have to take enough water to avoid this problem. Avoid too much salts. You have to eat a balanced diet, so you can also prevent these kind of problems. Yeah, so that's what you call as the kidney stones. Otherwise, the rest is just the same. Kumabe treatment yena temaza pesa physics ku form 3 sound. Some people may use what you call the ultrasound to destroy or to break these stones in the kidney. So imaka sound when the frequency yokwera yori musangave sound imene, it's beyond human audible range. Okay, so that sound can be used to treat the kidney stones. That is how is used. Otherwise, let us finish by looking at the gout, a condition where uric acid clusters build up in the joints. Okay, my joints more, there can be accumulation of these acids, and then you can have pains in the joints, right? Yeah, my joint tajani. All those things that are part of a gout. Komanso akasima infections ena or mafuto ena ngati bacteria can also cause the same thing. But ababa ngubanga zona kuti basic knowledge was ya secondary school. So can it be caused by high uric acid levels due to poor kidney functions or diet in the meal? Yeah, so all those things can cause what you call gout. So msakeni fuma kwambiri nizosavuta izi amafuso wake. Okay, tisafika mafuso pali fuso ngati pazimene tafotokoza mbuyozi izi pali fuso. That marks the end of this topic. If you made a fuso muzi kusana kwinako. So after this topic, if they can ask you questions like these ones. Define excretion and 1 mark. Okay, so be able to define these kind of questions. What is excretion? You can be able to define. And then the questions like name 3 waste that can be excreted or excreted, not extracted. Okay, I think it was auto collection, but it has to be excreted by the following. So the kidney, I think you can name 3 waste that can be excreted by the kidney. Okay, by the skin, okay, and by the lungs. So they're talking of mention some waste that can be excreted by kidney, by skin, by lungs. Okay. The other question is going to be name 2 processes of urine formation. So be able to name these kinds of processes. Okay, what happens to the one when he takes out of water? Be able to mention what happens. Okay, name the fluid found in the Bowman's capsule. Any fluid in the Bowman's capsule. So can be able to name. State the law of ADH hormone in osmogration. Be able to mention all these things. Okay, you can also talk about these kind of questions. Similarities of kidney and dialysis machine. Why excretion is important. Describe how the dialysis machine works. Describe the law of the following hormones in osmogration: ADH, aldosterone hormone. Okay. State 4 good healthy eating habits. And of course, list 3 common kidney problems. Just make sure you are able to answer the basic questions like our. Then you'll be fine. So in our next meeting, we'll look at what you call the coordination. So after looking at the coordination, we'll talk about the immunity. So that marks the end of biggest topics in biology form 4. Kwenago nzaba izi zangu vanga basic genetics, biotechnology, cancer, jani, nzaba izi. Okay, so any question?